Welcome back, everyone. Well, today we are talking about sinus. You know, it's underrated. People joke about it. People are like, it's not that bad. What's the big deal? Well, I'm joined today by Dr. Nadim from Ogden Clinic. Good morning.
Troy, good morning.
Is it true? Were my statements correct? It's just underrated.
You know, not for my patients.
Not from your patients,
I'll see
yes.
5 to 10 patients a day, and look at the numbers are staggering.
Yeah.
In the United States, 35 million office visits occur annually for chronic sinus problems.
Okay.
And if you live a life of a chronic sinus sufferer, headaches every morning and every night, missing days of work, it's a major problem.
But yet, your work colleagues, sometimes your bosses just go, take a Tylenol and you'll be fine. It's no big deal. But I want to talk to you about what you can do to fix the issues. And it's talking about sinuplasty, the balloon sinuplasty. What is it?
Yeah, so let's start with what sinusitis is.
Yeah.
It's obstruction of the sinus cavities.
Yeah.
So you have sinuses in the cheek, the forehead, and between the eyes. And when those little drainage tracts get blocked, they need to be opened. You can either do them medically with decongestants, antibiotics sometimes, but when that's a chronic condition, balloon sinuplasty is used. And it's a catheter with a balloon that fits into the sinus opening and dilates up that opening so you get persistent relief.
What is it that's blocked? What is it, mucus from the where?
Yes.
Like, for someone who doesn't suffer from it, can you explain a little bit more?
So sinuses are air-filled cavities.
Yes.
And those little drainage tracts need to stay open. And when you have colds or allergies, they'll cause them chronically to swell shut. So the balloon sinuplasty catheter, which is done in the office,
yes,
replaces the need to go to sleep under general anesthesia for traditional sinus surgery.
For major operations, this is now replacing it for certain candidates. How do you find out if you're one of those particular people?
That's a great
lucky
question.
enough, really, to be able to not go under anesthetic.
Interestingly, most sinus sufferers would be candidates, but it's based on a preoperative CAT scan. It looks at the anatomy. It looks to see if the sinus tracts are closed and if a balloon would be needed to open those up. If you suffer from polyps where tissue needs to be removed, you'd have to undergo traditional sinus surgery. But because this is minimally invasive with a balloon, does not remove tissue, the recovery is significantly better than those who undergo traditional sinus surgery.
How long does the procedure take?
It takes about 45 minutes in the office. I would put the analogy to a limited dental procedure.
Oh, okay.
You come in, you have anesthetic in the nose, and then the catheter is placed and the balloon is deployed, and it opens up that narrowed tract to about 3 times the size. It's a permanent fix. When you get this done, patients do very, very well. We participated in a national multi-center study comparing traditional sinus surgery to balloon procedure. Both patients did well, but the balloon group went to work a lot quicker and had less need for packing.
I was just about to say, I would assume the downtime is much quicker.
Much quicker, less bleeding.
Less invasive as well.
Correct.
Can you have those issues come back?
You can. There's always, but that's true of traditional surgery as well. And so people who suffer from allergies or have nasal polyps tend to have repeated symptoms, and they will need medical management maybe for the rest of their life.
I wanted to talk to you a little bit about what causes sinusitis to begin with.
It's a great question. Some of it's anatomy.
Yeah.
Some of it's a narrowed tract. Other things are the environment. Allergies are a main risk factor.
Okay.
And that's something you should check with your physician to be tested for, because if you suffer from repeated symptoms, it can make a big difference to find those factors out.
Do you find with the pollution now, with our inversions that we have here, and Glenn would be able to say more about it, I don't know how it all works, is that a major issue as well?
It is. It is. There's definite data that smog and pollution affects the sinus lining. Passive smoke exposure can affect it for those kids or adults that are exposed to that.
And it could be a lifelong thing as well if you don't have it checked out. Thank you so much for coming in. If you want to find out more about Ogden Clinic and whether you are the perfect candidate to actually have this done, head over to forutah.com/GTU and you will be able to find out more information with whether you actually need to have this done as well. Glenn?
That's right.